Dr. Vishnu Yu currently serves as Associate Professor at the Department of Panchakarma, Amrita School of Ayurveda. He has presented and attended many national and international seminars. He is also an active member in different social organizations like Rotary International, Medical Wing of Isha, etc. With great respect, I invite Dr. Vishnu to take over the session.
Om Amriteshwari Nama. My pranams to all the dignitaries, faculties, and students who are present here. So, coming to the topic, pharmacovigilance in Panchakarma. So, pharmacovigilance, though it deals with the reporting and the prevention of adverse drug reactions, in why it is pharmacovigilance, the role, what is there in the Panchakarma, because when we consider the Ayurvedic therapeutics, most of we adopt our treatment basically by two methods, the Shamana and Shodhana Chikitsa, and most of the for this purpose we use both internal and external therapies. And Panchakarma being a branch where most of the external therapies are handled, the pharmacovigilance is, or inculcating pharmacovigilance in Panchakarma is very necessary for a safer Ayurvedic practice. So, coming to the need of pharmacovigilance in Panchakarma. So, unlike the early 90s, since when after Panchakarma being a post-graduation or Panchakarma being a super specialization, there had been a wide range of Panchakarma practice throughout among the Ayurvedic fraternity. Like even a graduate, a BMS graduate student is confident enough to practice Panchakarma after his usual curriculum. So that much wide range has become the Panchakarma practice, and it has become a fundamental treatment tool for most of the physicians. So a safer practice should be ensured in perspective of Panchakarma. And mostly after the COVID pandemic, it is globally recognized as one of a natural detoxification method. And we don't know about how among the Western populations mainly, and we don't know how much they understand about what we are doing, but still it is globally recognized. So it is our prime duty that we ensure a safe practice and monitored practice, standard practice of Panchakarma to the modern fraternity also. And coming to the chance of patient vulnerability, you all know that if you have experienced in your lifetime a Panchakarma treatment, what the patient have to face in a Panchakarma theatre, because they will be of limited dress code, or they will be exposed to many people, like a therapist, like a physician, and you don't know who all will enter the theatre. So that should not happen. So we should take in consideration the confidence of the patient, that it is conducted in strict conduct and medical surveillance, so that they are confident to lie before you for the treatment purpose. So the chance of patient vulnerability is more due to different aspects in the theatre. So that's also a need of pharmacovigilance there. And coming to the by introducing the pharmacovigilance in Panchakarma, we can ensure and minimize the risk factors and ensure a less harm to the patients who is undergoing the Panchakarma Chikitsa. So the pharmacovigilance actually was foreseen by our acharyas as vyapats. I don't think in any other treatment modalities or procedures and treatment procedures mentioned by acharyas, this much caution is told in any because that's why this much cautions is told by the acharyas to an extent that there is a lot of hindrance among the physicians to practice Panchakarma, to practice Vamana, Virejana, such things. So that much care acharyas have already told to avoid the Vyapats. Like Acharya Charaka have told some 4 factors, Preshya, Vaishajya, Vaidhyana, Vaigunya, Adurasya. So more 4 factors which are responsible for all the complications or Vyapat which may cause in the theatre is already foreseen by the Acharyas, and you can't imagine like what all small mistakes or small mistakes they have foreseen in as Vyapats. So coming to this Preshya or the incompetence of the attendant, you can correlate as a procedural error or a nursing errors which may happen in the theatres. And the Dravya Nimitta or Vaishajya Nimitta, you can correlate with that adverse drug reactions and events which may happen. And coming to the Vaidya Nimitta, you can correlate with incompetence of the physician which may lead to medical errors. And coming to the Adra Nimitta, you can go for a non-complaint of the patient, or the patient is not following the regimes. So we can discuss all these factors as a like on the as a Vyapats, the reasons which may cause for complications. And first coming to the Karma Nimitta, many things when you say about the procedures like Vamana, or when you go for, if you, for example, and improper postures or thermal burns, such are the some of the incidents which are common in the theatres. So if you see that for example a video you see in YouTube, you search for Panchakarma, it is a highly practiced highly watched videos. You see the patient is sitting in a tool and a tub is kept in the floor, and the patient is vomiting. People are holding from different sides, and the patient is bending too much for vomiting. So actually these are improper postures which is already told as Vyapats, because the patient who is bending too much there for Vamana, the Acharyas have told it there will be Shira Koshta Pida. And if you try to like, we will not, like, if we try to integrate with the patient, there will be a slow development of headache or something like that. So such improper postures which the attendant or the nursing should have been taken care, so that also is causing a complication to the patient. So it can be considered as a procedural error. And another common thing which you people try to avoid or not report is thermal burns. So most of the Panchakarma procedures as such are like heat therapies. Like if you take Nadi Sweda, Bashva Sweda, all these are heat therapies, and there is a high chance of thermal burns as a complication, which is very common, but it is less reported because most of them it will be handled by the therapist, and they try to cover it up. So because they will be targeted for the same. So that is a main that is an error which is caused due to the procedural or the nursing error. Now next is the physical exhaustion, and because like in lack of proper monitoring about the vitals before the procedure, like the patient may lead to fatigue or hypoglycemia, malaise, etc. Because overdoing the procedures. Now it is summer season, so the patient is paying so much amount. So patient may tell that he want to sit in the steam chamber for a long time. So as the patient perspective, he is paying for the thank you. Because it's summer. So no, definitely because maybe it is summer, it's drying up. So the patient has paid for the treatment, and without considering the season, the patient is sitting in a steam chamber for a longer time, which will definitely going to result in a complication or fatigue. So that should be the care or care to be taken by the nursing assistant, and he should inform that for this climate this is not advised. You can sit for this much duration to avoid that complication. So that can also be considered under the nursing errors. And improper pre and post care. Always, like we tend to neglect the small care that we should do. Like a patient is infectious, he has done a treatment in the our pati or the doni, and improper cleaning before the next patient is admitted in the same table, there is a chance of infectious spread. So it is the duty of the nursing assistant that you clean the patient properly, you clean the doni properly before the next procedure. So to avoid this chance of spread of the infection to another person. And these are the possible reasons for the karma nimitta, like a lack of standard operating procedures, a lack of proper facilities. So what should be done in the procedure, how long it should be done, what should be the precautions, everything should be mentioned in the SOPs. And it should be explained in a regional language to the therapist also, because most of the time the therapist is the one who is handling the patient. So it should be properly explained to the therapist, and the physician also should ensure that it is followed. And the lack of proper facilities. Before I forgot to mention the patient slip. Another important mishappening in the theatre is the patient slip or fall. So the patient has come for a rejuvenation treatment, and finally he is going out with a bandage in the head. So that should be avoided actually. And because these are small events, but people tend to neglect it. But these all can come under the adverse happenings which can be reported in pharmacovigilance. Because for patient slips and fall, like if you are not using an anti-slip mat, if you don't have a grip bar in the bathroom, such mishappenings can be it can be happening in the theatres. So to avoid that, the proper facilities should be there in the theatre. And coming to the definitely there should be a proper training for the nurses of all the procedures, and SOP training, everything should be done. And inadequate monitoring, like only the physician's duty is to write the treatment and send the case sheet, and rest all is in the hand of the therapist. So that should not happen. And adequate monitoring is necessary so that to avoid such medical errors. Then coming to the dravya nimitta or adverse drug events, most of the Panchakarma procedures like Upanaha, Lepa or Stanika Bastis and all, there will be combinations of medicines which will be used, and the contact time of that particular medications will be more. Maybe we'll be keeping it for, if it is a Upanaha, we'll be keeping it for 12 hours or overnight or something like that. The contact time of those drugs will be very much more. Then that may result into the dermatological conditions like pruritus or erythema, such things. And by the time, we may have tied it in the afternoon time, and next day morning when we go and tell the patient to remove it, we will see there is erythema or pruritus or such symptoms developed. And the patient will be having that heating sensation, burning sensation and all, and patient may be thinking that it is due to the effect of the drug. So, but it is due to an adverse drug reaction. So we should inform the patient that no such magical effects are going to happen. You will feel a little heat burn. After that, it will be normal. So that the patient can report that if there is any adverse drug reactions. And even it includes a medication error, that improper dosage of the Mamana Aushadas or Virajana Aushadas, such things also come under the adverse drug events. So some of the reasons where it may cause for the adverse drug events are the shelf life of Mamana Virajana drugs. Means our acharyas have always stressed on that a seasonal collection of the drugs, Vamana Virejana drugs, should be taken, because the shelf life of these Vamana Virejana, because they are Tishna in nature, the shelf life is very less. So a seasonal collection of the drug is advised. But most of us, what we do is, in a year we will purchase some Madanaphala Pippili, and 2 years, 3 years, 4 years we will be using the same. And the patient, after Snehapana, everything, they will be struggling to do the Mamana. So because it is because of the lack of potency of the drug. So to avoid that, a seasonal change in collection and checking the quality of the medicines before administering the patient is necessary. And coming to the quality of therapeutic oils should be ensured. Like most of the, myself is also running a pharmacy. So most of the base of oil which we use is Tilataila based oil, and some are the coconut oil. So pure quality of Tilataila alone may cost you like from 800 to 1200 liter per liter. But we know many of our Taila, Dhanvandram, Mahadana, etc., where lot of milk, etc., is added, per 200 ml we will get for 120 rupees, 110 rupees. So because in market you will be there, you have a lot of varieties of Tilataila is available, but they are not original. They are synthetically processed and it is mixed with some other oils and made to have the values of Tilataila. So that if you check in the lab, you will get all the reports like of Tilataila. So such measures, minimum quality of the oil which is used for Abhyanga should be also ensured. And most of the cases where when there is a complication of of oil which is used, the therapist and this nursing staff may ignore it because they don't know about how the adverse reactions are happen, and by the time the physician knows about it, it will be worsened. So a method of reporting is very essential for the therapist also. And a practice of patch test or prick test is also very necessary for a safer practice. When you go for a Upanaha or some Lepa or something, you can go for a patch test and ensure that there is no drug reaction and go for the Upanaha. And coming to the Vaidya Nimitta or the diagnostic errors. So as Sir has mentioned, the medical error is the third largest cause for the death nowadays. And the diagnostic errors as such, like a failure of adequate diagnosis before the one's immediate diagnosis and a lack of proper dosaging according to that, all comes under this diagnostic errors, which is totally under the responsibility of the physician. So many reports or many things happen in our daily practices, like for example, even a patient who has undergone this angioplasty and he is diabetic, he came to you for a knee joint pain, and suddenly you start with all the kashayas, churnas, everything, and you tell him to stop all the modern medications he is taking. So that is also a medical error, because it is unethical to stop all this cardiac medicines or diabetic medicines along with your medicines, and the patient may collapse, and even it may be fatal. So that also is a wrong practice from the Vaidya. And even like in the first, second week of the pregnancy, the patient may come with you for a low backache. So instead of giving some external medications, you are giving Nirgundi Arandam, Mrudu Virejana you are planning. So this may cause anomaly to the child, and that is also a medical error. So such small things you should be cautious. And coming to the selection of the patients, like taking in the wrong patients for the Shodhana, like that. So all these things are the factors for which medical errors caused by the Vaidya. And finally, the non-compliant of the patient, that the patient is, like I before told, patient is not ready to follow the regimes followed told by the physician, or the patient is not willing to continue the treatment in between. Like these things happen, like the patient is starting Snehapana, second day the patient is is not willing to take more. So there we have to educate the patient. So what are the risks you may face if the Shodhana is not done? What are the risks if Snehapana is not continued? Such things should be taken, and it should be explained, and such mishappenings should be avoided. And coming to some of the reportings, like these are some of the publications where though they have mentioned that aromatherapy, these are all patients who have undergone abhyanga. So there was a development of exfoliative dermatitis by usage of Mahanarayana Thailam, and allergic. In the second study, there was allergic contact dermatitis while using a combination of 3 oils: the Hanvantram oil, Eladi oil, and Muruvenna. These 3 were mixed together and used. And because the patient had, and he developed much hypersensitivity, and because the patient wanted to continue, they did a patch test on it, and they found out that the allergic reaction was caused by the Eladi and Hanvantram Thailam, and our Muruvenna was safe for the patient, and they continue with it. But these things are done in the modern fraternity, and these things we can also follow and for a safer practice. This is a photo of the thermal burn. It is a condition where the Potali Sweda was not tied properly, and while during the procedure the Potali was open and the churna fell on the patient, and this much degree of burn has happened. This is not this initial picture. After some few weeks, this happened. Like the patient was advised to do Valigoseda at home, and already the patient was diabetic neuropathic patient, so they had less sensitivity of the food, and they did this Valigoseda, and finally it resulted in an open wound. So such all these mishappenings which occur during the practice of Panchakarma can be reported as adverse drug reactions. So to conclude, so uniformity is the key for standardization. So preparing a standard operating procedure of all the therapies is necessary to make it uniform, and development of validative tools to assess the therapeutic effect is regularly is also necessary to make it uniform, and training for therapists on ADR is very necessary, and adverse events should be recorded and reported, and surveillance for Panchakarma specialists is very necessary during the procedure. So look before you leap. So always calculate the risk before jumping on to the profit. So thank you.
We extend our sincere gratitude to Dr. Vishnu for his contribution to today's session. Thank you, sir. We welcome Dr. Priya ma'am to felicitate Dr. Vishnu, sir.